Hello, everyone, and welcome to our impact conversation on birth trauma. Today, I am so excited to be joined by Tila Tomasetti, who is a birth trauma psychologist, doctoral student, and mama spilling the tea, shedding light, and creating space to explore the impact of birth trauma. So this month in our Elevate social media, we are talking about a lot of things related to women's health. And birth trauma is something so significant and such a big part of this. But I feel like this is something that I have really only started learning about since following you. So, Tila, can you share with us a little bit about birth trauma, what it is, and how many women experience this?
Yeah, absolutely. Jocelyn, thank you, first of all, for having me on here today. It's such an important topic that we don't speak enough to, and is one that's kind of close to my heart too. So just wanted to thank you. Birth trauma, I want to start off by sharing, is very subjective. So when I get asked, like, what is birth trauma? It's not like a one size fits all. It's not something that kind of fits nice and neatly into a box that every single person would kind of subscribe to, but it's more so in the eye of the beholder. That's what a lot of people explain birth trauma as. So it's subjective and it's related to the experience of birth trauma. So it's something that could have taken place during the actual labor, in the moments immediately after the labor, and sometimes even in the days afterwards. Say if the mom had a stay in the NICU with her baby, which is the neonatal intensive care unit. And so birth trauma is, we can essentially think of it as like postpartum post-traumatic stress disorder. So the same symptoms, similar ones that you would apply to somebody with PTSD, you would apply them to birth trauma, but it's in relation to exactly what they experienced during the birth. So you would see things like flashbacks and nightmares and shame and guilt and avoidance. 1 in 3 women are said to describe their birth as traumatic, but more research, like more recent research, I should say, is saying 45% now. So that number keeps increasing. And I think that maybe the more we're talking about it, the more women are stepping forward to say, hey, this really resonates with me.
Wow, that statistic really it's really shocking actually. And as I mentioned, I anyone who doesn't follow Tila, first of all, you need to follow her on Instagram. I'm going to read it. It's at the T on birth trauma, and it's TEA. We'll share
Yeah,
that in the link. Your Instagram feed is remarkable, and the amount of information that you share is so in depth and so well put together and communicated. And I mean it shows how deep this issue is. So why has this, like, obviously this has always been an issue, but why is it now and maybe I say now, but in recent years, maybe you can kind of let us in on, like, how has this become more of a normal part of the conversation, and what has kind of sparked it to come to a space where we can have these conversations a little bit more openly?
Mhm. I think it's pages like this. And I think it's hearing other women's experiences. I think that's the most powerful thing about my page. I do a lot of like research based sharing. As a doctoral student, I really wanted to focus on the facts that exist out there because um, there's so much fiction on the internet and social media. So I wanted to make sure that people were getting the facts straight around this, and could also relate to it. So I've created that sense of community where, going back to kind of what is birth trauma, there's so many different causes to it. And so like anywhere from C-sections, to postpartum hemorrhages, to obstetric and midwifery violence, as well as hysterectomies or medical interventions that take place. So when you get onto a community like I've created on Instagram, you start to see your story in other women and other birthers, and you recognize that, like, I'm not alone in this. And I think that that's what's helping the conversation to start moving along. There's also really great documentaries the last few years that are speaking to this, like Birth Time World, I think was one that came out just this year. And so just more conversations are being had on bigger scales and reaching more people. And I think the power of that is that others step forward and, like I said, say, hey, like me too. Like I can relate to this experience. I'm not alone like I thought I was.
Wow.
Yeah.
And so when it comes to birth trauma, is this something that is reported? Like, is it something that a woman would go to the hospital or to her doctor, or would she seek the help of a psychologist? Or is it more often than not, women don't even know that what they experienced was birth trauma? They just think like, oh, that was just how it is. Like, some women have good births and some don't. Like, what does that process look like?
I'm so glad you're asking this question because so much of it exists in silence. Like, so
Mhm.
many women suffer in silence because we live in a culture that really encourages women to be quiet about concerns that they have in relation to being pregnant. Let's even back up to
Mm.
like infertility
Yes.
and miscarriages, leading all the way to being pregnant and then having difficulties during labor and delivery, resulting in birth trauma. So we exist in a culture that encourages women to say, like, just be quiet about this. This is something that you wanted. Okay.
Right.
And so don't complain about it and just practice gratitude. And so we see a lot in the community. It's something I challenge often with my followers is toxic positivity. This idea that, like, is the baby healthy? Well, then what are you worried about? What are you upset about? And just that focus there. So it really silences a lot of women who experience it. But if we think of something like obstetric and midwifery violence, you can absolutely report that experience. And that too, a lot of people don't know that. They think, they go through this horrific experience that could have been prevented in that instance with those kinds of violence, and they think there's nobody to talk to about this. But every hospital or, say, midwifery association has a reporting process where they can reach out and say, like, this experience was not right for me and these are the reasons why. And so it's actually something that I'm going through myself, actually. And so I can't speak to it, unfortunately, because it's in the midst of being reported. But once that is dealt with, I plan to explain to my followers exactly how to go about reporting. So it will be a topic that I do. Because I'd say I want to say around 30 to 40%. No, that's not true. It'd be higher. I'm thinking of something else there. It's around 60% of my followers. It's because of the way that they were treated and the way they were made to feel was the result of birth trauma. So research as of late is showing 66% of women who have birth trauma are saying at the root of that is the mistreatment from a product, like a provider. So it's powerful stuff. Like, yeah.
Wow. And thank you for creating a community where these conversations can happen, because I have to think that s- especially for those women who are going through the birthing experience for the first time, we don't know what is normal or not, like what is the appropriate way to be treated, or normal experiences. And I know that normal is, it's not the appropriate term, but until we have conversations and other people share, how would we ever know to identify something as a good or bad, and not just like, maybe I'm just making too much of this, right? So thank you for creating that space, and like sharing you like so much incredible research so that women can find a story that they resonate with, or that reflects their experience, so they can know, like, that wasn't okay, and these feelings that I'm having are justified, right?
Yeah, and so valid. Yeah, and truly, like, it's an honor to run this kind of page. Like, it's such a privilege to hold people's stories, and I'm sure you experience this, Jocelyn, right? When people share their stories with you, it's like there's such power to that, and I never take it for granted. Every single story I read on my page, or people that reach out to me daily, I want to sit and create as much space as I can to hold what they need, because it's like without those voices, then we can't change things like this. And we can change a lot of this. A lot of birth trauma can be prevented.
Which is such a hopeful, you know way and path forward. So with birth trauma, what are some of the, that you have seen through your research and through your community? What are some of those short term and long term impacts of birth trauma that women experience?
Mm. You ready for a long list? I'll try and keep this short. And I joke about it because sometimes we have to going through this experience, but it's really lengthy. And so, again, I think people think of this as like, oh, it's just a birth plan gone wrong. But it's like the
Mhm.
short term impacts are those PTSD symptoms that I started to list. So things like avoidance, isolation, flashbacks, nightmares, a lot of like breastfeeding struggles come as a result of this because there's like a disconnect that happens, bonding issues, fear, anxiety, depression. But then the longer term impacts that we see are like a lot of physical pain for moms, as well as intimacy issues, as well as like infections that you'll see, or a lot of them have fears around future pregnancies. So, unfortunately, one of the long term impacts is that a lot of moms become one and done, where they're like, I don't want to go through that experience. I almost lost my life giving birth, and I don't want to risk that again, or I don't think my mental health can handle it, as well as things like
Right.
relationship issues and friendship issues. So, it's just like I did a
Mm.
post recently on it, and it's just I ran out of room like on the little Instagram post square of trying to list all the long-term impacts of this. It's vast.
So is it fair to say then that I guess some of the impacts and the way that women experience it would be a combination of mental and physical, and the way, like, it might not necessarily be a physical trauma, it can be a mental trauma, it could be a combination, one or
Absolutely. Thank you for saying that. Because again, going back to like that one size doesn't fit all, that's what I stress on the page too, is that everybody has their own individual experience from it. So if you're telling me that the physical aspect of this particular part of your birth was traumatic, then it was traumatic. And
right.
no one gets to argue with you about that because again, trauma is subjective.
So on that note then, if there is a woman that, like, what might be those things that she would notice within herself to be like, like, yes, I know these conversations, right? Like, talking to other women is probably one way to help identify it. But like, what are those things that someone could kind of, yeah, recognize in themselves to be like, maybe this wasn't okay, and maybe I need to dive into this and deal with this so that it's not like I'm not suffering from long term. But yeah, how would a woman know if she experienced birth trauma, or is again that subjective?
Yeah, it's subjective. And I just want to encourage anyone listening that if you think something just didn't feel right about that experience, again, in the moments leading up to delivery, during delivery, and after, then like your experience is valid. And I want you to know that there's so many people out there that hear you and that want to validate that experience for you and kind of sit in it with you. But you can do things like seek a diagnosis if you wanted to. It's not necessary, but it's something that sometimes people feel that validation from as a doctor sitting there, kind of going through a checklist and saying, yeah, like you are struggling with postpartum post-traumatic stress disorder, which again, all of us refer to as birth trauma.
Okay.
So that would be one of the ways, as well as like getting to connect with communities like my own and others that I'll kind of mention near the end.
Yeah.
um, and just yeah, it's through others experiences sometimes that we're able to name our own.
Yes. Isn't that interesting how, um I know it happens in so many circumstances where it's like so far after, or not until we hear someone else. And this is the power of story, going back to what you said, with when people um, bless you with sharing their story, it's the power of that story where others can recognize things that have happened to them, and things that we may not have given much of a thought to in the moment, because when it comes to childbirth, it's like, well, we wanted to have a baby, so these are the things that happen, and yeah, outcomes that could be there because of what we wanted, this choice we made, right?
Definitely, definitely.
So interesting.
Mhm.
So what are some of the resources available to women that want to learn more about what birth trauma is, if it's something that they've experienced? And yeah, let's start with resources first, because then I have another question, but I don't want to lump them all together. So yeah, let's start with some resources, places to start.
Okay, my favorite resource to give everyone is Postpartum Support International. So PSI is what they also go by, and they have an incredible amount of resources, and they're all free.
Oh,
So if you want to access like online support groups for, again, like partners experience birth trauma, I think that's really important to point out. So they even have like dads groups and birth trauma groups and postpartum anxiety and depression, and like there's just an abundance of resources there. And if you wanted to seek out therapy, I say start first by going on PSI's website, because what you can do is, because it's literally international. It's not just the name, but it is the fact that it's across the world. And so when you go onto that website, you can actually put the area you're in, and then what they'll generate is perinatal psychologists, which is what I am. So I not only specialize in birth trauma, but like miscarriages, infertilities, postpartum depression and anxiety, things of that nature, and of course, birth trauma. And so it'll be able to narrow down your search, and you'll get certified people who understand your experience. So that's the first one I would say. If you're looking for your own therapist, you can go on Psychology Today. So I'm on there as well. And you would put in the search engine words of birth trauma. And then again, perinatal psychologist should come up in your area. One of the things I would suggest too is to look for a therapist who does EMDR, which is also known as eye movement desensitization and reprocessing. Very long name. That's why we go with EMDR. But it is proven to be one of the most effective therapy styles for trauma. And then
okay.
I would say like there's online groups, there's other Instagram pages, there's a ton of really great Facebook pages actually, where like Postpartum Support International has one. There's one called like a birth and trauma support group. There's one specific to like say people who have had like hemorrhages or C-sections. So there's massive community of people out there sharing their experiences and connecting with each other. So those would be some of the first to come to mind.
Okay. And so a little further on that. So, what would you say for either a woman who has experienced birth trauma or the support system of a woman who has gone through that? What would be like that first action step that the woman or her supports could take to really help her with what she's navigating?
I love this question. It makes me so happy. Um, connect,
Mm,
connect. Like, it's one of the things that I'm going to dedicate part of my doctoral project on, and I'm speaking at the Postpartum Support International Conference in July. It's in New Orleans, and
Congratulations.
thank you. I'm so excited. They've invited me to talk about birth trauma, and I'm going to speak to how post-traumatic growth is what can come after trauma. So it's this incredible thing that as a result of going through something absolutely horrific, there's so many parts of us that can grow and change and transform in like pretty beautiful ways. And so one of the ways that we do that is through connection, is through a sense of community and what's known as common humanity. So when we can experience that with other people, so that's like, I can't stress it enough. So I'm just so glad you asked. Is just reach out and just recognize that you are not alone, and you don't have to heal from this alone either. So even though that experience may have isolated you, my hope is that you just break out of that and seek the help that you deserve.
Mm, thank you for sharing that.
Yeah, thanks for
And
asking.
yes, well, and I want to share that again, going back to your Instagram page, because it is phenomenal. There is everything, like you dive into the depths of birth trauma. You also, I love how you share those, I guess, the like what not to say is because those are an important thing. And so I think it's important for those of us supporting people to look at those. Don't say these things, because while the intention is good, it's not serving the person that experienced it. And it's there's just so many powerful pieces of information that you share. So I definitely encourage people to check that out. One other question I wanted to ask is, so if we were to talk a little bit about like the physical health side of things, are there like what are some of those physical health or like women's health issues that are related to birth trauma? Like, are there, I know there are so many things when it's, we don't just experience one thing. So we have birth trauma that has potentially led to XYZ, but what are there's like some common things that you see are kind of really interconnected there?
Yeah, I do. And whenever I'm invited to speak or when I go on a podcast, I always get questions in advance, right? And what I always do is I pick one to give out to my followers because I really want their voices to directly be heard on whatever platform I'm speaking on. So this was actually the question that I posed to all of them last night. So if you give me a second, I've got it right
Yes.
here. I'm going to read to the actual answers. And so there's a
Okay.
ton of overlap. And so most of these things that you're about to hear actually came up repeatedly. And so I'll
Wow.
just say them once, but I just want you to know that they came up quite a bit.
Okay.
So first and foremost, obviously they connected to mental health because that is a
Mm,
women's health issue is mental health.
yes.
But then they spoke to the pelvic floor issues that a lot of women deal with. And so that doesn't just come, I hope I can say the word vaginally. Okay,
Yep.
good. I'm like, I
You can
hope so
say it.
in this day and
Yeah.
age, but it doesn't just come from vaginal births, it also comes from C-sections. So we often think, oh, if we didn't use that part of ourselves, we wouldn't have pelvic floor issues, but you absolutely can, as well as blood pressure issues. So things like preeclampsia, which is a very common birth trauma form as well. Quite often they further experience blood pressure issues after the baby's even been born. And so
Okay.
they're at risk of certain things. Gallbladder issues, you see that a lot, as well as reproductive rights, like the autonomy to be able to choose in the future. A lot of women can't have children afterwards because an emergency hysterectomy took place as a result of complications from birth, as well as incontinence. We hear that a lot, prolapse, scar tissue, infertility, sexual dysfunction, as well as like physical injuries from it for women who have like episiotomies or
Yeah.
vacuum assisted births, and then infections. And so, even just to share, I didn't talk at all, I guess, about my own birth trauma experience, but one of the health issues I saw, Jocelyn, was C. diff. So, I don't know if you've ever heard of C. diff.
No.
Oh my goodness. It's this crazy infection that is typically found in older people or people dying of like cancer and things like that. And it was as a result of the second hemorrhage I had. So I had an excessive hemorrhage, almost lost my life, losing more than half of the blood in my body. And then 6 weeks later, I hemorrhaged again due to a retained placenta. And while I was there getting the DNC surgery to get the placenta out 6 weeks later, I caught C. diff in the hospital. And usually you take this incredible medication called vancomycin, and it's supposed to like evaporate that C. diff and you would be fine. I relapsed 4 times. It's so, and you're violently ill. Like some people die from C. diff. It's very serious infection. And then as a result of relapsing 4 times, I ended up becoming a part of a study at the University of Alberta for the fecal transplant, like the C. diff research that they're doing. So after the first fecal transplant, it had an 80% success rate. I failed it, and I relapsed again from C. diff and had to have a second one. And now I'm knock on wood, excited to say that it's been like 6 months finally free of C. diff. But that's a major health issue. Well, as a new mom, right, as a brand new first time mom taking care of a newborn, was violently ill every day from C. diff for months and months.
Oh my.
So there's, yeah, so there's incredible, it's like a domino effect. That's how I describe birth trauma. It's not just this one isolated incident. It really like just compounds and hits so many other parts of your life.
Wow. I I am so sorry that you have and are going through that, Tila. Like that,
Jocelyn.
I can't.
Yeah, it's I'm out of the woods now, thankfully. But you know, if this would have been 6 months talking to you, it was hard. It was a really tough
Oh,
place to be while managing being a new mom, you know? Yeah.
yes, I can't imagine because yes, the being a new mom when everything is going wonderfully is so hard, let alone like having such um trauma and significant serious health issues on top of that, where how do you look after this little one and yourself when
Yeah. Yeah. So again, going back to like, you're not alone if you're hearing yourself in parts of my own story,
yeah.
and that struggle that exists afterwards. There's a lot of unfair, unrealistic expectations placed on us. And so you're not alone in feeling the pressure of that. So just reach out. I can't stress it enough.
Thank you for sharing that. I want to just close with one final question, which I know we've kind of talked about, but if you were to share one thing about birth trauma that you wish everybody could know, what would that be?
Ooh, that's hard. That's a tough question. One thing that it is real and impacts 1 in 3. Yeah.
That statistic is just honestly, it's mind blowing. So, thank you so much for your time. Thank you for sharing with us. This is such an important topic. We will be sharing your Instagram in the video links. This goes to
Awesome.
show you know, my tech savviness.
You're doing
Um,
great.
but thank you for the work that you're doing in the community that you have built and continue to grow. I just, it's very incredible what you're doing. So thank you for the gift that you're bringing to so many women.
Jocelyn, thank you so much for having me and allowing me the space to talk about this.
My pleasure. I look forward to the next time we can chat.
Thank you.